Good evening, I'm Jessica Moore. On the same day he announced data indicating we've passed the high point of infections, Governor Cuomo told New Yorkers about the rollout of what he calls the most aggressive antibody testing in the entire country. CBS 2's Hazel Sanchez has the story.
This Midtown clinic is one of many in New York now offering COVID-19 antibody testing. Governor Cuomo says the testing could help shorten the timeline for reopening the state, which appears to be moving in the right direction. The COVID-19 rate of infection is stabilizing and the rate of hospitalization is down.
We are past the high point, and all indications at this point are that we are on a descent. Whether or not the descent continues depends on what we do.
Starting Monday, the State Department of Health will begin conducting a statewide FDA-approved antibody testing survey, sampling 3,000 people for a population of 19.5 million people. Germany performed a 3,000-person sample with a population of 83 million. The large-scale testing will show how much of the population could now be immune to the virus, possibly allowing more people to safely go back to work. Dr. Ayman Attia, a primary care physician in Whitestone, Queens, has already begun administering COVID-19 antibody tests.
How critical is it to have these tests?
I think this is a very important test, but we don't want to give false hope to other people because this test has some limitations.
U.S. regulators say more than 70,000 companies have signed up to sell antibody tests, a blood test that can yield results in 24 hours. Because of its simplicity, the FDA waived the initial review of the test as part of its emergency response to the outbreak, leading critics to question its accuracy. People in the early stages of infection could test negative since they've yet to develop detectable antibodies. And Dr. Attia adds some who test positive for coronavirus antibodies are not necessarily immune to COVID-19.
You could be exposed to the other mild coronavirus, not the bad one that we have now, the COVID-19, and therefore we get false impression that you're immune, but you really are not immune against this bad virus. You are immune against the old virus.
Dr. Attia and other medical experts say antibody testing should be paired with diagnostic testing like nasal swabs to determine if someone is currently infected. On Sunday, Governor Cuomo announced the state is working with the federal government to increase diagnostic testing. Hazel Sanchez, CBS 2 News.